This Focus on Health segment is brought to you by Aurora Healthcare.
Hello and welcome to Focus on Health. I'm Ted Stefaniak. As you can see today, we are not at the Aurora Medical Center in Oshkosh. Instead, we are at the Oshkosh Sports Complex. Why? Well, we're talking about knee injuries. We're going to be bringing in Dr. Paul Fagan. He's an orthopedic surgeon at Aurora, and we're talking about ACL injuries, what's involved in the surgery, recovery, and prevention. Well, we're doing something a little different today. We're out on a football field where, you see a lot of these ACL injuries. But Dr. Fagan, it's not always on the football field. It could be any sport or just everyday life that you tear an ACL.
Absolutely. We see those sometimes with missteps in your everyday life, especially winters here in Wisconsin when it's slippery, or awkward steps down the stairs as well.
Okay, now we always hear the term ACL, but what exactly are we talking about? What happens in the knee when we have that tear?
All right, so the full word for it is the Anterior Cruciate ligament. And basically, it is in your knee. It connects the two bones, the femur or the thigh bone, and the tibia or the shin bone. And it prevents basically that shin bone from going anteriorly in relation to the femur. It also has some role in rotational stability of the knee.
And that's a pretty important ligament in your knee, especially if you're doing anything physical like you are an athlete.
Yeah, absolutely. And it's probably less important for people like runners or cyclists that are more in a parallel sort of orientation. But anytime you're participating in cutting or pivoting activity, anything like that, ACL is very important.
Now, one thing I've heard that I've seen a baseball pitcher and some other people have an ACL tear but not necessarily get it fixed. Is it always important to get that ACL fixed?
Well, it's very dependent on your lifestyle and the activities that you want to get back to. Some folks go through rehab, get a good range of motion, strengthen the muscles around the knee, and perform very, very well. However, if there is any level of instability, we know that you probably need to have that reconstructed. Oftentimes, particularly in our younger athletes, we've seen that if they don't have the ACL reconstructed, they have injuries to their other structures, like the cartilage on the ends of the bones, or the meniscus, which is a cartilage pad in the knee that's basically a shock absorber.
Now, we'll talk about prevention in just a moment, but let's just talk about what happens when you have an ACL tear. And then the process of getting it fixed. Many times, we've seen professional football players in Green Bay or high school or college athletes, after a tear, doesn't look like it's necessarily a major injury, and then it turns out to be an ACL. How is it diagnosed?
Absolutely. So going to what you're saying, a lot of people think that it has to be a contact injury. It's more often a non-contact or pivoting type of an injury. As far as diagnosis, a lot of that is based on our clinical exam, and we can note that the knee feels loose or sloppy, and then we typically get an MRI. That will show the soft tissues of the knee very well, so we can see whether or not that ligament's intact. We can also see if there are any other injuries to other ligaments in the knee, the meniscus, like I mentioned before, or any of the cartilage surfaces.
So if it is torn and it's deemed that there needs to be a repair or a reconstruction, what's involved in that? And I know there are a lot of different options when it comes to the type of repair that's made.
Absolutely. So in preparing for surgery, we typically send our patients to physical therapy to help get some of the swelling down, strengthen some of the muscles around the knee, and also to get the range of motion. When you have swelling in your knee, it really limits the mobility. So we need to make sure that you have a full range of motion of that knee. That said, there are a lot of different options for reconstruction. We can use preferably grafts from your own body. So that would involve typically your patellar tendon, perhaps your quadriceps tendon, or your hamstrings tendon. And all of those work very well and actually have more strength to them than your native ACL. In the event that perhaps you're a little bit older, we sometimes elect to use a donated tissue from a cadaver. However, we have seen increased rates of re-tears using those types of grafts in the past.
In talking about re-tears or other potential injuries, is there a high rate of occurrence of another ACL injury happening in that same knee?
There is a risk of re-tearing that. We have definitely improved our techniques and our knowledge of the anatomy the position that we're putting these grafts and the way that we're fixing them. But with the proper amount of rehab, that's definitely lessened the risk. I would say more often than not, you're more likely to have a tear in your opposite knee after tearing it in one knee.
And how about recovery? I've seen many people go through recovery. This is a relatively long-term recovery process, isn't it?
It's prolonged, and we typically say that we're going to get to know each other over the next 6 months anyway. When we talk about folks returning to high-level activities like the NFL or even college athletes, a lot of times that takes closer to a year. In order to work on strengthening and stability of that knee and really getting it to feel like a normal knee again.
And I guess the big thing, we see the ACL injuries far too often in professional college, especially high school, Is there anything we can do to prevent or slow down that tear in that ACL?
Definitely. There are a number of studies in the United States as well as out of Europe that have shown that ACL injury prevention strategies have really worked to decrease the number of injuries. These are oftentimes in European athletes, skiers, team handball players, soccer players, and the same thing here in the United States. This is oftentimes called jump training, or the fancy word we use for that is proprioceptive training. And a lot of this is just basically trying to improve your mechanics when you land awkwardly, when you jump down from any sort of a position, and to put you at a better position when you're doing any sort of twisting activity to help prevent that sort of injury. This jump training is something that we're working to instate here at Aurora as well.
All right, I know a lot of varying opinions and techniques with the ACL, but let me get your thoughts on this in terms of multi-sport athletes compared to athletes that specialize in one sport. Do you see anything in what you've seen over the years in terms of an ACL injury occurring for a multi-sport athlete compared to a specialty athlete?
Actually in the knee, there's not a whole lot of difference. We certainly see a lot more of these repetitive use type of injuries in single sport athletes, predominantly in the upper extremity, particularly shoulder and elbow. We think a lot about pitchers and throwing athletes, but there's not a lot of data that says that if you do play one sport year-round that it puts you at more risk to a particular knee injury. However, with any of this, we really recommend cross-training and taking at least a month to 3 months off of any sport year-round to really diversify your training program.
And would you say that a month to 3 months, you want to spread that out at the beginning of the season, end of the season, or you just want, if you got a 12-month period here that an athlete's in, 3 months off, or maybe a month and a half before the season, month and a half after?
Yeah, either way I think works very well. A lot of times this is, we see fall sports, and these athletes will be participating in different sports in the wintertime, so I think that's good for diversity. We see some of these going year-round, again, baseball, some of the soccer players playing indoor soccer as well, and hockey players in addition that play summer, they play fall, they play winter, they play spring leagues as well, and really just don't get enough diversity in their training.
Get some rest and a little diversity, and you might be able to take care of that knee a little better.
Absolutely.
All right, well, we appreciate you taking some time on a warm day here in the middle of a football field.
Hey, we appreciate it. Never going to complain about a sunny day here.
It's also worth pointing out that Dr. Fagan is fellowship trained in sports medicine, so if you have any questions about an ACL, or maybe you've got a knee injury, or you're just looking for a second opinion, give him a call over at Aurora at 303-8700. I'm Ted Stefaniak, and we'll see you next time on Focus on Health.
This Focus on Health segment has been brought to you by Aurora Healthcare.